Do you have chronic pain? If you do, you need to watch this video. I talked to physical therapist Eileen Kopsaftis about the number one reason pain doesn't go away. So Eileen, tell us about the number one reason pain doesn't go away.
Yes, and I know that's kind of a strong statement because there could be a lot of reasons, but what I found in the 30 years I've been doing this is the number one reason is because the cause has not been addressed. And I know that can confuse people sometimes, but often what I see, especially with chronic pain patients, is they're chasing the symptoms. They're going after where the pain hurts, why does it hurt? May or may not have a medical explanation behind it. A lot of people aren't aware that 70% of people who complain of back pain, it's exact cause unknown. If you look at it on our pie chart, 70% is exact cause unknown. And so that means there's a lot to learn in healthcare. And so if they're not addressing the cause and they're chasing the symptoms, then a lot of the times they're chasing their tail and they're not getting anywhere. So the pain is not going away. So, and by chasing the symptoms, I mean they're treating that painful body part or that painful area. They're icing it, heating it, massaging it, stretching it, exercising it, injecting it, medicating it, surgically altering it. But what if that's not the reason the pain is there? And so, and a lot of times people they'll alleviate the pain somewhat, a little bit, take the edge off. And then it comes back with a vengeance, even worse. Or it moves to another body part. It's, oh my gosh, it used to be my right knee, now it's my left knee. What on earth is going on? I'm falling apart. So it's because the original problem, the original cause, or what I like to say, culprit, hasn't been addressed. I wrote my book, Pain Culprits, and I like to say the culprit is causing the problem, but the culprit is quiet. Culprit isn't making any noise. So we're beating up the victim.
Oh, that's a really nice way of thinking about it.
Yes. So, and I don't want to get ahead of myself, but 5 of the most common reasons that the cause is not addressed or the cause isn't known and people are chasing their tail. One of them is medications, side effects of medications. People are completely clueless most of the time that a lot of their pain is being caused by their medications as a side effect. I'll never forget, I had a woman come into the clinic who had some pretty serious leg pain. And, I chased myself in circles trying to get this woman better. And I'm usually very effective at helping people to alleviate pain. And I was getting nowhere with this person after a couple of sessions. And I just was scratching my head. And then she came in her next session and she said, my leg pain is pretty much gone. And I knew it wasn't anything I'd done. And she proceeded to share with me that she had stopped taking her statin medication, which was causing tremendous leg pain, and she wasn't aware of it. So needless to say, she had to have a conversation with her prescribing practitioner. I don't tell anyone to stop taking medication. That's completely outside the scope of my practice. However, I can teach on medications that is completely within the scope of my licensure, and I can tell people to the signs and symptoms to watch for. I can completely inform them of the risks and the benefits and all of the data attached to the medication. So after that, I looked at the medications of every one of the patients who walked through the door, every one of the consult that I work with online all over the world. And it's shocking how often pain is a side effect of common medications. So, and that's an entire chapter in my book. So that's one reason. Another reason that is, it's commonly known in the healthier nutrition aspect of the world, but it's not so common in the general population, commonly known, I should say, and that is food. Food can be a huge offending factor when it comes to pain. And there is a great deal of data behind that. I spent about 8 months researching the data for a course I created for Food Choices Academy on obesity and pain. And obviously you don't need to be carrying excess weight to have chronic pain. Mm-hmm. However, excess weight it contributes to chronic pain. And it's mainly because we used to think, I'll never forget, there was this one movement expert that I heard lecture one time. And he said, we look at the muscle cell under the microscope and it's the 4th of July going off. The muscle cell is so active and all kinds of things are happening. He said, and we look at a fat cell under the microscope and it just stares back at you and it does nothing. Well, that was decades ago. We know a very different story now because our technology has improved, our knowledge has improved. And fat cells are huge producers of inflammatory cytokines. And so when somebody is carrying excess weight, they are very likely carrying a chronic inflammatory condition along with that excess weight, which promotes pain. And that's been seen over and over and over. And food does promote chronic inflammation as well, even if you're not carrying excess weight. And there's a lot of studies, a couple that I love to cite because they're so simple to relate and they're so profound. There was a study done on over 1,000 women, and they looked at how many cruciferous vegetables they consumed every day. And that's broccoli, Brussels sprouts, cauliflower, anyone who's not sure what that is. And it was fascinating that the more of those vegetables they consumed, the lower the inflammatory markers in the body. They were doing blood tests, and they saw it was a definite relationship. And then there was one on whole grains, and that was on younger population. And they also saw a relationship between the more whole grains they consumed, the lower the inflammatory blood markers in their body. So food really has a huge impact on how we feel. And I'm, just from personal experience, consulting with people and teaching them how to nourish their body. I call it a Nourish Away Pain course, a Nourish Your Body for Life course. I taught it at the local community college. I used to bring 4-course meals and feed everybody while I was teaching them. Because, they look at a healthy recipe and they think, I'm not going to like that. But they love it because it's real food. I'm not bringing stuff you only find in some specialty store that costs a fortune and nobody knows what it is or how to cook it. And they don't want to put it in their mouth. So it makes a huge difference. And I saw in those classes, people would come in, oh my goodness. And after just 1 week, and they would tell me that their pain was better, that their joint pain was better, their migraines were better, their everything was better in sometimes just 1 week. So food plays a huge role.
Yeah, I've got an interview with a man called Paul Yude, and he had really severe and crippling arthritis in his hands. His hands were like this. There was so much he couldn't do. He was in pain all the time. And he started to read about milk and animal suffering and so on and so on. And he decided to stop it all for the animals. So he stopped it all and was amazed to find that all his pain went. And his hands are still quite deformed because, as he said, the damage had already been done. But there's no pain there anymore for him. And he now runs ultra marathons and he's 80.
Oh, I love it. I love it. And it is new to it. I remember I had a couple come into my classes from Denmark, and she was in her 80s. And they were in their 80s. And she was using a cane to help her ambulate. And I'll never forget it. She said, as long as I follow your regimen, she called it my regimen because of where she was from, said, as long as I follow your regimen, I don't have any joint pain. It was phenomenal. And with her, it was really the dairy. The dairy was the kicker. That's a huge offending factor for most people.
Yeah.
And interesting because people just don't want to give up their cheese. However, a lot of that has to do with the fact that cheese makes your opiate receptors in your brain very happy. So it's very addicting, but it's legal. But all the things it does to the body, we do not want. It is not our friend. So those are two that, may or may not be known by people, medication, side effects, and food, how that can impact our body. Oh, and I forgot to mention, there's another thing with food, arachidonic acid, which is an essential fatty acid. However, our body can convert the healthy acids or linoleic acids, the healthy fats, oils in plants to make all the arachidonic acid that we need. So we don't need to get it directly from food. We can convert it from healthy plants. However, we get it directly from animal foods. And the more animal foods we consume, the more arachidonic acid is directly put into our bodies. And it's kind of like putting a brick on the gas pedal of the inflammatory process. It really promotes those unhealthy immune responses that we don't want. So, and I would tell people that they have to be 100% vegan, because as soon as you use the V word, a lot of people just shut down and they go away and they turn off the channel and all of that. And also the data doesn't really support that you have to be 100% vegan. Really, the data supports, and this is based on a lot of T. Colin Campbell's work and other people's work, the data supports as long as you limit your animal food intake to 10% or less, which I tell people is 2 or 3 times a week. And that's why I say I don't like the word moderation, because it's very ambiguous and most people have a different idea of what moderation is. So giving them a definitive number is usually much more helpful.
So you're saying 2 to 3 times a week for meat and dairy, the whole thing?
Well, I tend to and want people to eliminate dairy completely. Yes, it is an animal food, but I've not found any small amount of dairy that doesn't do harm, especially people who are dealing with chronic pain. So that's the food and the meds. And then there are 3 other common that I've seen causes that may not be commonly known. And one of them is water intake. A lot of times people aren't aware just how important water is. A lot of the things that people aren't aware of with water. And specifically, we only need to be about 3% dehydrated for a lot of really unhealthy things to occur in our body. And I could go on ad nauseum for a couple of hours on it, which I won't. I'll keep it to pain. Muscles are almost 80% water. They're like 78% water. And if a muscle doesn't have enough water, it's going to go into like a low-level spasm because it's not happy. And who's aware that muscle spasms create pain? Most people. So sometimes your muscles are unhappy just because you're not drinking enough water. And oh my goodness, I've read that, there's a massive number of people in the Western world specifically who do not drink enough water. Or they're drinking a lot of caffeinated beverages, alcohol beverages that dehydrate us because it tricks us into losing water. And so very, very unhappy circumstance for that. And it just causes havoc, joints, discs, everything in the body really needs us to be well hydrated. And for those who may be older in years and concerned about losing muscle mass, that whole age-related lean muscle loss is really very inaccurate. It's time-related for being sitting on your bum and not doing anything, working to our age, and everything to do with not working and not exercising and not moving. But water, a lack of water will inhibit people from gaining muscle, from getting stronger, especially if that's become a goal of theirs. So it's very important.
And that's it. It is actually easy to drink more water. I keep a pint glass. And, because I generally work from home, I top it up. And then if I go to the gym, I take more water and so on. And if you're running errands or out at work, you can do it. I think it's no good waiting till you feel thirsty. My experience of actually increasing my water was like, I'm not particularly thirsty. And then I started making a habit of drinking more water. And then I suddenly started to find I was feeling more thirsty. And it was like I'd been thirsty all that time, but my body had sort of gone, there's no point in doing all the I'm thirsty messages because she's not going to listen. But as soon as I started drinking more water, you're thirsty messages started coming up and it became easier and easier to drink more water.
Yeah. And you're not the first person I've heard that from. I have a good friend, a neighbor, who I would visit all the time. And I was concerned about her because she was in her 80s and she would spend hours out in her raspberry patch. She loved picking all of her raspberries and making raspberry jam and all kinds of wonderful things. And she never drank water. And I was very concerned that out in the heat, she was going to end up with a heat stroke because she was dehydrated. And she's like, I'm never thirsty. I said, it's because you're not drinking water. Your thirst mechanism is shut down.
Yeah.
And sometimes our thirst mechanism can trigger hunger because we think it's tricking us and making it so some people are overeating when they actually need to be drinking water. And that's a whole other story. But so to appease me, she said she'd start drinking more water. And I stopped in a few days after that and she started yelling at me, telling me, what did you do to me? I'm thirsty all the time now. I can't even get water. It was so funny. I just started laughing. I said, good, your thirst mechanism is working now. That's a good thing. Yes, so true. So true. So, okay, so down to the other two, that these are fairly, I would almost say, kind of, I don't want to say secret, but so not known, it's ridiculous. And it should be known. It's one of the reasons that I do so many online free events. I've done 31 free events since August of 2020. And it's because people need to know this stuff. And so, inauthentic exercising. And people would say, what do you mean by inauthentic? And what I mean by that is we tend to want to isolate muscles, isolate certain movements in the gym or at home, thinking that we're doing a good thing. And this is kind of mainstream knowledge. This is what your average athletic trainer will teach you, or a movement specialist, or a rehab specialist. Even my profession is really guilty of doing this, isolating muscles. And it's not how the body's designed. And so I'll give a simple example. You'll go to the gym and you will sit in one of those seats and you'll put your feet behind the little bar and you'll push your feet up to straighten your knees out against resistance. It's a knee extension resistance machine. Yeah. Everybody wants to work their quads. They want those quads to be popping. And the problem with that is, while yes, your quads will straighten your knee, the interesting part is they're not really designed to do that repetitively against resistance. What they're actually designed to do, instead of getting shorter, is getting longer as we lower our body weight. For instance, when you go to sit in a chair or when you're descending stairs, the quads are going to control what your knee is doing, what that joint is doing, so you don't collapse and fall in a heap on the floor. Our body really is designed mostly to respond to movement once it's been initiated. And how it responds is by getting longer and controlling that movement. So the muscle lengthens under tension, which for those people who understand muscle contractions, that's an eccentric contraction. I call it an eccentric load, because it gets longer and it's kind of building power. And, I forgot my little flying monkey. It's downstairs in my gym. But I have a little flying monkey that I can pull that elastic and make it longer and longer and longer and tell people this is kind of what your muscles are doing. And as that elastic gets longer, it's building energy, tensional energy. The longer it gets, the more tensional energy is built in there. And then when you release it, the power gets released. So I tell them their muscles are loading and unloading. They're loading to build that power, and then they're unloading that power. So when you do a squat, when you go down, you're loading your hamstrings and your glutes. You're loading max, which most people have sat on for 20 or 30 years, and max has gotten flat and weak and atrophied and can't even help them push open a heavy door because they've been sitting on max for 30 years. But if max is working, they can sit in a chair with control where they can squat 20 times, 30 times, 40 times without a problem. Students in my online academy where we do weekly classes, live classes, our average age is 70. And we had one class, we did 90 squats in 8 minutes. Wow. Those people, they rock. And some of them had to do it modified. Some of them might even be holding on to something and not going down that low. But we're loading and unloading the power muscles. And if people are plopping in a chair, they're at a very high risk of some serious decline and maybe not ending up where they ever set a goal to go. So very, very important. So inauthentic exercises, we go in the gym and we do those things. We stand and we put our foot against something and we bend our knee against resistance to work our hamstrings. Your hamstring, yes, it will shorten and bend the knee. However, its real purpose in life is to control your knee as you're walking and literally help your knee to straighten. Muscles work in the context of the task or the activity we're performing. And most people think of muscles as what the anatomy expert finds on a cadaver. It's connected here, it's connected here, so when it gets shortened, that must be what it does. Now, that is what it can do, but I often kind of joke, as a matter of fact, I did a video on my YouTube channel and I said, are you training like a dead person?
Great title.
Yeah. So that, and unfortunately, that's what most people do. And I can't tell you how many people I have dealt with who had tendinitis, who came in, who spend 3, 4, 5 days a week going to the gym. I mean, they're not there all day. They're not, 4 hours. They're not in a bodybuilding competition. They're your average person going for an hour after work or before work. And that tendinitis sets in because they're trying to isolate a muscle. They're trying to make sure they use no other body part, which is the body gets so confused and says, what are you doing? I even say when you go to, a tricep, okay, let me make, my shirt's a little tight here. So I'm going to make sure I just work this tricep. So I'm going to keep this right here and I'm going to isolate that tricep. And that's all I'm going to do is let that tricep work. Well, the rest of the body says, we want to help. And the tricep says, why are you making me do this all by myself? And, there's this physics thing. And it's called, gravity and ground reaction force and massive momentum, and all this stuff is involved in body movement. If you go to push your suitcase over your head in the overhead compartment on an airplane, you are not saying, oh, I better keep my elbow in and I better not use any of the water muscles or only use my tricep for this. I better not cheat. No, you're going to squat down a little bit, especially if it's a heavy suitcase. So now you've just loaded your lower body and your power source. You're going to push through to get that up overhead. You're going to use your entire body to put that up in that overhead. But when we go to the gym, we try to cut the whole body out of the mix. And that's what causes tendinitis, tendinosis, tendinopathy, injury, inflammation, unhealthy, unhappy joints. So
not all gym regimes are like that.
No, but isolating.
But isolating, yeah.
Yes.
Rather than looking at whole movements, functional movements, and so on, yeah?
Correct. Yes. Absolutely.
For me, the machines are a real no-no because they're designed for the average man. I'm not even a man, let alone an average one.
Yeah, so the 10-inch male, actually. So if you're not 5 foot 10 inches, it certainly won't fit you.
Yeah.
Yes. And, they have been attempting to do better with the machines. They have a lot more adjustments available on them now. But the average person, they did a study, the average person would only make 1 or 2 adjustments.
Yeah.
Well, they could make up to 8 or 9 adjustments. Now, some of it has to do with lack of knowledge. I don't know how to, I've gone to gyms and, many, many years ago, I don't know how to make this thing change what it needs to fit me. I have no clue. You'd have to go find somebody. And you don't want to draw attention. You just want to get your workout done and get in and get out and all of that. But free weights are definitely better. Body weight can be fabulous. There's a lot of ways to do good things. Yes, absolutely. And another thing about the machines that I tell people is, if you're in a press machine and you can press 200 pounds. Well, when you go out in the real world and you've got to lift something that's 200 pounds or push something that's 200 pounds, you think you've got the strength to do it, but you really don't, because the machine would support you. It gives you that external stability that your internal body didn't have to provide. So now when you're not in a machine and you're going to do a free weight, you're not as strong because your internal core hasn't had to provide the stability. So you risk an injury as well. So, all right, last one. I alluded to this when I said the culprit beating up the victim and not addressing the culprit. And I just want to give a couple of examples. The shoulder. Everybody wants to treat the rotator cuff. Everybody wants to tell you, oh, it's your rotator cuff, it's your rotator cuff. There is data that they screened an entire village with imaging and found, I think it was 2/3 of the villagers had partial or full thickness tears of the rotator cuff. The interesting part, only about 20% of them had symptoms. So that means you can walk around with a tear in your rotator cuff and not have any symptoms at all. So when we see the tear, we think, oh, that must be why your shoulder hurts. The shoulder is the most mobile joint in the body. Everybody wants to beat up the rotator cuff. It's only 4 little muscles designed to stabilize the joint. Those rotator cuff muscles are not designed to push, pull, lift, do all the heavy loading. You've got 18 muscles that directly impact the shoulder, of which only 4 is the rotator cuff. And the entire rest of the body indirectly impacts the function of the shoulder. So if you've got an issue going on in your pelvis or your hips, even your ankle, it can impact shoulder function. I had a 22-year-old quarterback come in who was rock solid muscle from his nose to his toes, and he had a diagnosis of shoulder tendonitis. And I assessed his shoulder, and there was nothing wrong with it whatsoever. I asked him to show me how he threw a football, because that's when he had his pain, doing his 3-hour, 3-man throw practices. And he threw the football, and I immediately saw that his ankle was very unstable. Asked him about that, and he said, "Oh yeah, I roll out on it a lot in practice. I got to walk off the pain." I kind of cringed, thinking, why are they letting this kid play with an unstable ankle? But that's another topic. And we basically 3 or 4 sessions spent giving him work to strengthen and stabilize his ankle. Never touched his shoulder, and he completely was resolved of any shoulder symptoms whatsoever and could throw that football for hours with no symptoms. So, as I like to say, everything's connected to everything else. The shoulder was a victim. The culprit was the ankle.
Right. Yeah.
You know, the knee is just the lower hip and the upper ankle. It's that the hip bone, the femur, the thigh bone is the hip and the upper knee. And then the shin bone or the tibia is the ankle and the lower knee. So that knee is just a simple hinge joint with no place to go. It's stuck between those two body parts. And if they aren't working, the hip is the second most mobile joint in the body, but it's weight bearing. If it's not working right, the knee won't be happy. And the ankle is the most complex joint in the body. Everything happens from the ground up. And if the ankle's not right, and so many people have a history of ankle issues, it is insane. And because that ankle sprain recovered, no more pain, they went back to doing whatever they wanted to do, their activities, their sports, whatever. Nobody ever thinks about it. Oh yeah, I sprained my ankle like 8 years ago. Well, when did your knee pain start? Sometimes it might have only been a year ago, but it's because that ankle hasn't been functioning properly. And everybody's treating the knee, and that's why they can't get the pain to go.
Brilliant. Brilliant.
Yes.
That's really good. Now, you've got a book, you've got a YouTube channel, you've got online stuff. People can see you in person. Tell us about all that, please.
Yeah. So I do a lot of online events. They're all free. I've done tons of online events for aging. I've done Age Without Decline, Power Aging, Reverse Aging. I've done events on pain-free sitting. A lot of people have back pain when they sit. I've done events on plantar fasciitis. I just did one on bunions. A lot of people don't realize bunions can be reversible. I have a little video that gives them it's a little 4-minute quiz that they can answer and know if they can reverse their bunion without surgical intervention. There's lots of things that people need to know. So that's why I put all those things out there. My YouTube channel, obviously, it's all free. I do have online training. I have a Move Without Pain private club, which does have, they can kind of test the waters and take the free class.
I'm going to put all the links to your YouTube channel, all the information about your book, your website, and so on. We'll put it all in the description so that people can find that really easily. Thank you so much. I've really enjoyed talking to you, and you're clearly really knowledgeable and very definitely see pain in a holistic way.